Catheter ablation has emerged as an excellent, minimally invasive treatment option for atrial fibrillation. Our specialists are some of the most experienced in performing this procedure, with success rates among the best in the nation. They'll work with you to decide if an ablation is right for you. Doctors Patrick Chu, Brian Baranowski, and Waleed Saliba will tell you more.
For those patients where medications have not been able to control their atrial fibrillation, obviously their lives have been affected. Some patients can be very symptomatic with atrial fibrillation. It can interfere with their ability to do daily activities. So ablation as a means of controlling and settling down this atrial fibrillation can vastly improve those patients' lives.
We know the initial trigger, the initial spark or the initial firing for atrial fibrillation tends to come from the pulmonary veins. And these are the four veins that are draining blood that has just gone through the lung and picked up oxygen back to the left side of the heart so it can then be pumped everywhere it needs to go. There's little muscular sleeves that line those veins, and those muscle cells, for whatever reason, in select individuals can act in a very irritable fashion where they fire very, very rapidly. And that tends to serve as the initial spark that sets people off into atrial fibrillation, shorting out the entire chamber. Medicines, when we use them as an approach to the management of atrial fibrillation, try to calm down that irritability. When the medicines are ineffective, and we're going to take the patient to the next level of our therapeutic approach and go for an ablation procedure, what we're doing is burning or ablating the tissue around those veins to ultimately turn that tissue over into scar. Scar doesn't conduct electricity, therefore if there's electrical firing within the vein, that electrical firing can't exit the vein and short out the entire chamber.
So essentially, a catheter ablation is similar to a heart catheterization, which most patients are probably familiar with. Typically, at the clinic here, we use 3 or 4 catheters that have different functions. What we do is we put those catheters through the groin all the way in the heart. One catheter is, for example, an intracardiac ultrasound so that we can see what's going on inside the heart. Another catheter is the ablation catheter. And then we have a catheter which is the mapping catheter so that we can look at the electrical activity inside the left atrium. As we cross to the left side of the heart, the left atrium, this is where actually most of the action of atrial fibrillation happens. And we use the mapping catheter to see where the electrical activity is and how much electrical activity is around the pulmonary veins. And we use the ablation catheter to cauterize and eliminate this electrical activity and to confirm that we have isolation of the pulmonary veins so that the impulses that come from the pulmonary veins don't make it to the left atrium, and therefore maximizing the chances of keeping the patient in normal rhythm.
We don't use general anesthesia usually. We use something called cautious sedation. And they're comfortably sedated, usually sleeping, but readily arousable. The procedure itself, starting from coming into the room and then to leaving the room, is probably around 5 to 6 hours. A lot of the time is spent in getting the catheters in, getting into the left upper chamber, and then at the end getting everything out. So I would say about half the time is the ablation time.
A lot of the pioneering work in terms of driving how the ablation procedure evolved was done at our institution, so we had the experience with which types of procedures, which approaches, which catheters, which mapping systems work best. And I think that gives us an advantage then, having experience seeing the evolution of the ablation procedure take off in terms of providing the best possible approach that we need for our patients when they ultimately decide, and we decide with them, that the ablation procedure is the correct procedure for them.